Welcome back to Between Two Bushes. Hi, I'm Dr. Stephanie Schull. I'm the inventor of Kegelbell, and I am so excited to have this mini-series with our special guest star, the Vagina Coach.
I don't know if I'm a guest star, but hi.
I'll call her Kim during this time, but she is the Vagina Coach. And this is a really special episode where we're going to get all the information she has in her brain about the pelvic floor and the experience of pregnancy. We're going to talk a little bit about pre-pregnancy, during pregnancy, and then post-pregnancy. And Kim's a real expert in this area, and she has books on it, apps to help with it, all sorts of things. So Kim, I just wanted to start out with a question about, let's say someone plans on getting pregnant, but they're not pregnant yet. So what could they do to prepare for pregnancy?
So I'll focus mainly on the pelvic floor. So there's lots of things nutritionally, all that kind of stuff, sleep that they can be doing. But in terms of kind of my area of focus being the pelvic floor, being the core, being our body and kind of the house that's going to grow that babe, we want to optimize as much as we can. And pelvic floor physical therapy or physiotherapy, if you're in Canada, is something that I promote for every single person, every single woman, especially if they've been pregnant or given birth. But if we can take it a step kind of earlier, where somebody who's considering starting a family, starting by seeing a pelvic floor physical therapist. So that helps them understand their body. And I think most people that I deal with now are still learning about pelvic floor physio, and they have been pregnant, they've given birth, it's been years and years, and they are, sometimes 40, 50, 60 years old the first time they go, and they think, oh my gosh, how have I lived in this body for this long and never known this about my own vagina or my vulva or my pelvis? And so having an opportunity to experience that and learn that and understand your body preconception, I think is really, really powerful. And I don't actually know of research on this as of yet, but there are a lot of people talking about the role of optimizing the pelvic floor in actually increasing fertility. So looking at ways that energetically we may have some things hindering the process of becoming pregnant. And if we can address those through pelvic floor physio, it can be really, really life-changing. So that would be my number one thing, is see a pelvic floor physio, start understanding the function of your pelvic floor, your ability to contract and relax, and ways that you can be optimizing your pelvis for fertility, but when you're pregnant as well, in the postpartum period, and then for life.
Yeah, I'd add one tiny little element that I think is kind of intriguing, and that is if someone's experiencing vaginal dryness, they may be using a lot of artificial lubricant whilst trying to get pregnant.
Yep.
During intercourse in order to get pregnant. And most artificial lubricants harm sperm. So it's counterproductive. You're using basically a spermicide while trying to get pregnant. But if they're dry, they can't really do the intercourse part. So there they are.
Right.
And so while dryness can have many causes, one of them can be lack of tone of the pelvic floor. So engaging the pelvic floor, exercising it, bringing the blood flow back can, for a subset of people, help them regain their natural lubrication, which can help fertility for that reason. Yep. And I'm one of them who I was dry throughout my 30s and early 40s. And my experiments when I was inventing Kegelbell brought back my natural lubrication, and I have no need for artificial lubricant anymore.
Yeah, awesome.
So that's just a fun thing to think about from that angle. But okay, let's say, yay, they got pregnant. What can they do now that it's real and it's happening? What can they do while pregnant? Because pregnant women are told not to do so many things. Don't take this, don't do that. And in fact, at Kegelbell, we say, don't use Kegelbell while you're pregnant unless your doctor clears you to use it. And it's not that it's anything exotic. The function's more or less like intercourse. But nevertheless, pregnancy is such a delicate situation for some women. But what do you think largely a woman can do? Because I hear from women who say, I'm pregnant, what can I do?
Yeah. Yeah. There's a lot of can't do's for sure. And so people sometimes come in with a bit of fear, like, what am I allowed to do? And what can I eat? And how can I move? And so same thing as before, where I definitely feel that pelvic floor physio plays a role in our well-being when we're pregnant. I think building a pelvic health team, a birth team, whatever, that includes pelvic floor is really, really important. That is essentially, there's a lot of biomechanical changes that are happening to our body while we're pregnant. There's a lot of adaptation. There's increased load on the pelvic floor. There's stretch to the abdominal muscles. There's a shifting center of gravity that can all influence how we hold ourselves. The muscles that we use for core stability, their roles become sometimes hindered because of the stretch and because of the way that the weight is distributed in our body. So things maybe are working a little bit differently, or maybe not as optimally. So if we can stay on top of that with the help of a pelvic floor physio and then certain movement that we do, then I think that that's really, really essential. And really, that's kind of how I got into this. Was I didn't know about it pre-conception. I didn't even know about pelvic floor physio when I was pregnant, but I did know that I wanted to do as much as I could proactively to avoid what my mom had gone through. So that was kind of my introduction. I didn't know about pelvic floor physio till I think it was like, I don't know, maybe 6 or so months, maybe even a year after my second son was born. So preparing the body for birth is really how I started. I looked at birth is like an event. It's like a marathon. It's like a triathlon. It's like a mountain climb. It's an event that we are preparing for, that is going to be demanding of our physical endurance and strength, our mental, our spiritual, everything is going to be challenged. So if we can train for that event with the principle of specificity from fitness, which basically says, okay, if you are going to run a marathon, then you're going to run progressively long distances over a period of time. Then you're going to taper off right before your race day. You're going to go perform, and then there's going to be a recovery element after. So I looked at birth the same way. So while I'm pregnant, I'm training in ways that will prepare me for birth, looking at birth positioning, looking at how I'm going to move, the mind-body connection, all the things that I can be doing to help train my body and ready it for that day. I'm going to taper off in the weeks before so that I have built up my energy stores and I'm ready when it's time to give birth. And then there will be a structured protocol or recovery plan afterwards so that I can ensure that I get back to the form and function that I had before. Yeah. So I look at it's fitness, really. It's birth prep fitness with an emphasis on the pelvic floor and the abdominal wall.
I love that. Birth prep fitness. And it's like preparing for a marathon.
Yeah. Yeah.
We should give it that care and concern. And, part of the problem here in the United States is our healthcare system is really complex and confusing. And the resources that are out there, it's hard for women to be in touch with them, which is why your book and your app on Prepare to Push may be the only resources a lot of women in the United States can have access to.
Yeah, and I know that especially during the time we've been in recently with COVID, there was no in-person treatments that were happening. So women were kind of scrambling and looking for what they could find on the internet. And there's some great resources, but there's also some not great resources on the internet. So it can sometimes be a bit of a scary place or to get people going down a bit of a rabbit hole. But I created the Prepare to Push program in 2000. So not long after I technically started my business in 2009, that was the first thing I did. As I looked at fitness and I looked at birth, and I had taken doula training as well, and I created this program to help women, first of all, get the information to start talking about the pelvic floor, but looking at it in ways that gave them practical, implementable, is that a word? Things they could implement into their life that felt like they were in control and felt like they were doing something that was going to increase their confidence and outcomes for birth.
Yes, thank you. I'm glad, especially in these times, especially in the United States. It's good that you've gone through all that information so that they aren't just, Dr. Googling all these answers, that you've really, developed the right material set over a decade, of learning. Well, okay, so still about pregnancy. you have some really interesting things to say about like posture and perineal massage. And I don't think that's things that people normally think about when they're pregnant. So I'm really curious as to what you have to say about that.
Yeah, so perineal massage was, the first time I heard about it was when my sister-in-law was pregnant, or well, after she gave birth, and I was asking, you know, how did she prepare? What did she do? And that was the first time I'd heard of it. So then I started researching it, talked about it with my midwives. They said, you know, I said, what else is there? Is there anything else like that I can be doing? Is there something more I could be doing? And pardon me, they had recommended that product, the Epino, which unfortunately is not available in North America, but
crazy to me because it's such a, I don't want to talk about a device that's not available, but I looked for it when I was doing my research about, you remember when I thought I was going to be a coach and I was looking for that tool, and I could see it existed in the world and I couldn't figure out. Anyway.
Yeah, it's a very valuable device. If you know somebody in Australia or in Europe who can purchase one for you and send it to you, it's definitely worth the investment. But it's unfortunately, government has got in the way of a really, really amazing device. So I'll just leave it at that. But anyway, so that device helps with perineal massage. There are other things. So you can do perineal massage manually yourself with your own hands. You can have, if you have a willing partner to help you, they can do it for you or with you. There's also a new product designed by a pelvic floor physical therapist in Toronto called the Kegel Release Curve, which is, it's a stainless steel kind of S-shaped product that has a thinner end and a thicker end. And sometimes accessing your own vagina, vulva with your fingers when you're quite pregnant can be challenging. And if you don't have a partner or a willing partner, then having something that adds length to your arm almost can be a really great tool. So that's something that I like as well. But perineal massage has been shown in research to be beneficial. And it's not a 100% guarantee that if you do it, you're going to prevent tearing. Absolutely not. There are so many things that go into birth that we can't say that this will 100% prevent it. Yeah, exactly. Too many variables, but it has been shown to reduce potentially the severity of tearing and maybe the likelihood of it happening in the first place. I recommend it around 35 to 37 weeks of pregnancy, done daily. And it is, it's more of a way, rather than thinking of it as stretching the tissues, I view it more of a way to introduce sensations like stretch and pressure and discomfort, and trying, again, looking at that principle of specificity. How can I train in ways that is going to prepare me for that event? And in that event, I'm going to face these sensations at a greater degree, but I'm going to face these sensations. So if I can learn what to do while I'm pregnant before I'm actually giving birth, then my performance may be better. So really it's a way to introduce discomfort. It's a bit of stretch, and then you understanding what you need to do in your body to let go of tension and to surrender to that and to allow that softening and ease to happen. Because really birth is an elimination, and we need to allow, the pelvic floor needs to relax to allow that to happen. So yeah.
I feel like the mind-body connection is going to be a theme throughout our whole mini series. I think it's going to come up at every turn. Now, posture, if you could just say about that, and I'm going to wiggle in my seat as we're talking about posture. And I suffer from scoliosis, so it's always an issue with me.
Yeah. So posture, this is whether you're pregnant or not, but in pregnancy, we have that shifting center of gravity. We have that load. We have those muscles being stretched. So there's other forces that are at work rather than when we're not pregnant. But the pelvis is a series of, we have joints. So we have the pubic joint in the front. So we have the pubic joint in the front, and we have at the back the SI joints. So this is your sacrum, these are your ilium bones, and these are your SI joints. So we have some movement in our pelvis. I'll get my other one that moves a little bit too. So we have some movement in this joint and a little bit here at the front. Not a whole heck of a lot, but we do have some. And at the base of our sacrum, we have our tailbone or our coccyx, and that's an attachment point for the pelvic floor, as are the two sit bones and that pubic joint at the front. So we have kind of this diamond shape, and this is the pelvic outlet. So when we're giving birth, the babe comes into the inlet and it comes out the outlet. And we need as much space here, and we need as little resistance in the muscles as we can have. If we have been standing or sitting in non-optimal posture, and by that I mean in a more tucked position. So a lot of people, we spend more time sitting, and a lot of people sit with their sacrum against their chair or their couch or whatever it is that they're sitting on. And that puts a lot of strain on the joints. So again, whether you're pregnant or not, SI joint pain is quite common, back pain is quite common. So that's one thing. But also what happens is because we have movement in that joint, it can contribute to that tailbone moving, migrating a little bit closer to the pubic joint, which then the muscles adapt by shortening and holding on to more tension rather than being at their optimal resting length. Mm-hmm. So a neutral pelvis would be where, and you guys can all, anybody who's sitting watching this, you can do it with me now, sit and guide your pubic joint, kind of like asking it to nod forward. And what that does is it'll place your vulva on the surface of whatever it is that you're sitting on. And your two hip bones, so those bony points at the front of your pelvis, should be in the same plane as your pubic joint. So that would be considered a neutral pelvis. I'll show you with the muscles here now. So there would be a neutral pelvis. So here's the vulva right here. The vulva is on the surface of the chair. And the tailbone and sacrum are not, they are free. And that means the muscles can be at their optimal resting length and therefore free of tension. Well, they have the right amount of tension that they need. And especially things like incontinence, when we sneeze, there's an increase in intra-abdominal pressure up above. And if our pelvic floor has adapted to a short, tight state, the muscles are not able to respond as well to that increase in pressure. Yes. They like to respond when they're here because then they have the full available, they have the full capacity to contract fully and then relax again fully as needed. But if they've already used up some of their energy by being held in that short, tight state, when they get asked to respond to a sneeze, there's just a little bit left. So they're kind of tired. And so while we're pregnant, we also can take advantage of the fact that our pubic joint acts like a little bit of a shelf for our bladder. And then obviously as our belly is growing out in front, we have more support when our pelvis is in neutral. When we're sitting more here, everything kind of falls right on the pelvic floor muscles and ligaments. And over time, they can start to become tighter or more lax on one side based on how we're holding ourselves. So if we can spend more time in neutral, not to say you can't ever slouch, we absolutely need to have a bit of slouch time, but for the majority of our day, let's spend our time in neutral.
I love it. It's making me think while you're saying that if you could spread that message wider, have it become common knowledge, maybe mothers will tell their daughters, instead of cross your legs, and just sitting up straight for maybe not the most important of reasons. And it'll be instead a correction on this posture and training kids for life.
And it's just an awareness thing, really. At the end of the day, it's about most people, the changes that are happening in pregnancy it's an evolution that we just kind of are unconsciously adapting to it. And before we know it, our pelvis is kind of in that tucked position because we've adapted by thinking we're going to tip forward as our belly grows. So we kind of start to lean back and tip our pelvis forward. And we don't know we're doing it. We're not consciously doing that. It's just an adaptation. And then once the babe is born, our body has adapted to that. And then it's kind of, we need a little bit of an undoing. And really it's posture is, as you say, if we can tell our kids now, so many kids are spending time here on computers and on their phones, and poor posture is a pandemic, really.
Yeah.
So yeah.
I mean, gosh, it was like a broken record when I was growing up. Cross your legs, cross your legs. We were taught, and I've since learned that crossing our legs is not a great position to be in for a number of reasons. Yeah. It's always interesting to me when they do like the blood pressure test, they say uncross your legs. It's like, why are we teaching people to do something? Totally. At any rate, okay. So I wanted to ask you about incontinence, bladder leakage during pregnancy, but you can also talk about, gas and fecal leakage if you want to. I know that that's also a possibility. And before you answer this, I just wanted to say that I was at an event with a very famous female fitness instructor. She has millions of followers, sells a lot of products in retail stores. And she was on stage talking, and she was pregnant. And she said she just had some bladder leakage when she was walking with her husband, and she was surprised and didn't understand what was going on. And yet it's just, there's no shame in not knowing. We don't know because no one talks about it, even a fitness instructor with that kind of following of people. So I just think that what you're about to say is really important. And even though we think we know it, I think it bears repeating.
Yeah. It can happen at any stage in life, even when we're not pregnant. When we are pregnant, we have, again, those postural changes, which are a huge contributor to that. So muscles that aren't able to respond to those changes in increases in intra-abdominal pressure. But we also have less space. So there's pressure on the bladder, and that can set people up in the sense of almost like urge incontinence, where they start to go to the bathroom more often because there's not as much space in there. And then their body adapts to that, thinking, oh, we should go every hour. Okay, I'll start signaling you every hour. So then they so it's kind of this whole, without the awareness, you just kind of are blindly assuming that that's just what's happening now because I'm pregnant or because I've had babies. And so research is now showing that pelvic floor exercise that is started in pregnancy can decrease the likelihood of you developing it later on in pregnancy, but also the likelihood of it continuing on as being a problem after. And there's also studies to show that if you do have incontinence while you're pregnant, the chances of you continuing to have it if you don't address it are very, very high. So it is something that it's a signal. People, again, are kind of like, oh, it's just because I'm pregnant, it'll go away. And they don't necessarily do anything to address it. And, people might say, oh, you're pregnant, make sure you do your Kegel exercises. But again, that verbal instruction isn't necessarily serving people. Right. So it happens, but we need to get on top of it. We need to pay attention to that signal, especially while we're pregnant. One, because we need to make sure that if what's happening is the fact that our pelvic floor is holding on to more tension and it's not able to respond because it's kind of tired and overworked, that tension is going to also hinder us while we're trying to give birth. We want that muscle to be able to relax. We want the space to be able to open in the pelvis. And if we're holding on to tension there, then it's something that we really want to address. So pay attention to the signal if that's happening to you.
Love it. Love it. So lots going on when someone's pregnant, and our cultural awareness of some of these more fundamental issues is lacking. So we're preparing the nursery and we're preparing the baby shower, and the big part of the show that's really happening is our bodies and our pelvic area. They have to do the work that whole time. So I think it deserves attention, and I appreciate you working on it and sharing what you know. And so thank you for your time.
Thank you.
See you at the next episode.
See you then.